and health education. And you can also ask question about how to manage stress and how to come out of depression. So we in the meanwhile we will talk about balanced diet. Balanced diet for a common man, most important topic is balanced diet. In the initial part of this video, we will discuss some basic points about balanced diet. In between video, you can ask any question. So, balanced diet is a diet which contain all the nutrients which are required for our body for healthy life. There are many nutrients and every nutrient is important. Keep this fact in the mind that every nutrient is important. Deficiency of any nutrient. Deficiency of any nutrient will cause disease. So we have to give importance to every nutrient. So first of all, we must know what are the nutrients. So there are many nutrients. Some names I am enumerating. Protein, you know very well. Fat, carbohydrate, which you call carbs. Vitamins, mineral, fiber, and water. There are many vitamins, there are many minerals. For a common man, there is no need to go in the depth of every vitamin. Just keep the name of vitamin B3, and in the mineral we should remember two mineral, calcium and iron. That much from the vitamin and mineral is important. Going to the more basic formula, if we keep the balance between protein and fat and take normal food like normal people, by keeping the amount of protein and fat nearly equal, then it is very easy to balance all the nutrients, because it is very difficult to remember the amount of every nutrient and the name of every nutrient. Just keep this formula and it will work for most of the diet in the world. Just try to keep amount of protein just equal to the fat. Our body can adjust if some excess protein, some excess fat is taken. But if any nutrient is in very low amount, how it can increase? By nearly equal means, if protein is 30 gram, fat is 50 gram, it's okay. But if protein is 30 gram and fat is 100 gram, it is not okay. So try to keep amount of protein and fat nearly equal. In this way, we can easily balance diet because we don't take any food or diet after measuring in weight machine, after using calculator or mathematics. This is the simple formula which you can take. Just try to keep amount of protein nearly equal to the fat by taking by in normal diet, not experimental diet. Keep this in fact. There are two types of diet. One is normal, one is experimental. Normal diet is a diet which most of our surrounding people are taking for many years. Millions of people taking normal diet for many years. That diet has to be taken, and in this diet we should try to keep amount of protein just equal to the amount of fat. What's problem in the Indian diet is that the quantity of fat is double, triple. In some people diet it is more than 5 times. That's the problem. That's why heart attack and diabetes in India comes 10 to 15 year before the from the other countries. So if you want to prevent diabetes and heart attack, high cholesterol, high blood pressure type of diseases, you should learn balanced diet. You can ask any question about balanced diet and any health related issue, and the most important topic which I have talked yesterday, the depression disease. So as we talk about, there are many nutrients and we have not to remember all the names of vitamins and minerals. Just take one name, vitamin B3, and from minerals just take calcium and iron. So there are two categories of nutrients. One is called major nutrient, macronutrient, and other nutrients are called micronutrients. So name of macronutrients are protein, carbohydrate, which we call as carb, fat, fiber, and water. All these five nutrients we require in grams, means in more quantity compared to the other nutrients. These are called macronutrients. And there are two micronutrients. One is vitamin, second one is minerals. So macronutrients and micronutrients both are essential. Keep this in mind. Macronutrient is as important as micronutrient. Micronutrient is as important as macronutrient. So there are two more categories in nutrients. One which provide calories, and other type of nutrients does not provide calorie. Those nutrients which provide calories are carbohydrate, protein, and fat. I'm making repetition. The nutrients, the three nutrients which provide calorie are carbohydrate, which we call as carb, protein, and fat. Some people will think that is protein gives calorie. Yes, protein also provide us calorie. Now some people will think that is calorie good or bad. See, In our food, it is must to have calories. Minimum calorie is required. We need around 1800 to 2200 calorie per day for healthy life for normal people. So, um, if any food contain very high calorie and other food contain very low calorie, it doesn't mean it is healthy or unhealthy. Calorie should be balanced and should be loaded with other nutrients which does not provide calorie like fiber, water, vitamin and minerals. Vitamin, mineral, fiber and water does not provide us calorie. Those nutrients which provide calorie is important as those nutrients which does not provide calorie. So calorie nutrients important and non-calorie nutrients are also important. So there should be a balance in the calorie. We should take 10 to 15% calorie from protein. We should take 50 to 70% calorie from carbohydrate, and from fat we should take 20 to 25% calorie. This formula works in many diets, and by using percentage formula it become very easy. Our diet should be balanced. We can take little bit more food, it doesn't affect, but it should be balanced. That is more important. Amount Balanced diet is more important than the amount of diet. Keep this in mind. Balanced diet is more important than an amount of diet. Some people think that if they lessen the calorie or if they lessen the amount of diet, their diet will become balanced. But this is not the case. Those who are having micronutrient deficiency like calcium deficiency, iron deficiency, this type of people, if they reduce the amount of amount of food, then there will be reduction in the deficiency in the uh, micronutrient too. So keep this in my mind. Diet should be balanced. It's more important than the amount of the diet. Keep this in mind. So we should take 10 to 15% calorie from protein. From fat we should take 20 to 25% calorie, and from carbs we should take 60 to 70 calorie. For the vegetarian diet, those who are taking whole grain and taking oil as a fat main component. Those who are taking daily non-veg and not using oil and taking refined flours, means they are not taking whole grain flour, they are eating noodles, pizza, or bread, burger, this type of things. For these people, the amount of fat is little bit more than 25 to 30%, and carbohydrate should be reduced by 10%. It is 50 to 60% because they are taking more refined carbohydrate. That's why it is important. But keep this in mind, if you are vegetarian or non-vegetarian, we should keep the protein calorie percentage from 10 to 15%. This is must. Keep this in mind. This is must. So, is there any question? We take a 1 minute break, then we will come again. Thank you very much.